Hello, my name's Weenink and I'm a junior doctor working in the East Midlands of England. Welcome to my presentation on laparoscopic hysterectomy trends over 13 years in a tertiary setting. Please feel free to pause the presentation at any time to review the graphics in more detail. The progression from laparotomies to laparoscopic techniques is well documented within surgery in general, and the same is true for gynecology. This comes with many benefits including shorter hospital stays, reduced complication rates and lower overall costs. However, it takes a great amount of training and skill to perform these procedures. This study is based at Royal Derby Hospital, and this image shows which hospitals in the UK have the highest rate of laparoscopic hysterectomies in 2019, which is the final year of this study. Royal Derby Hospital sits in first place here, though these figures may have changed slightly during COVID. The aims of this study were to see how the routes of hysterectomies have changed at Royal Derby Hospital, if there has been an impact on operation times and conversion rates as a department, and if there's any correlation between the experience of a surgeon and the operation times and conversion rates. To do this, we retrospectively extracted data from Royal Derby Hospital's theatre system for the gynecology department from 2007 to late 2019, where 54,000 operations were found. These were then coded as either total laparoscopic hysterectomies, total abdominal hysterectomies, or converted TLHs, which were found by comparing the planned operation details with performed operation details. For these three categories, a total of 3,390 operations were found. This graph shows the change in number of hysterectomies performed by laparoscopic and abdominal approaches from 2007 to 2019 within the department. You can see that TLHs only started at Royal Derby in 2008 and were performed at a steady rate until 2012, where their numbers began to increase swiftly. By 2016, TLHs were consistently performed more frequently than abdominal hysterectomies. This decline in total abdominal hysterectomies and increase in total laparoscopic hysterectomies was a significant finding from this study. Here it shows the operation times from start to finish of TLHs within the department. By 2012, the same year that the number of TLHs markedly increased at Royal Derby, there's a reduction in operating times. This improvement continues into the most recent 3 years of the study, with a significant decrease in procedure times in 2019 compared to 2016, 17 and 18, with an overall reduction of 22 minutes on average over the 11 years. Conversion rates have followed a similar pattern, with far higher instances of conversion from laparoscopic to open in the earlier years. Since 2016, the departmental conversion rate at Royal Derby Hospital is consistently less than 2%, with a conversion rate of 0.9% in 2019, which is a significant improvement on recent years. This graph demonstrates each surgeon within the department. The dark blue bar represents the number of TLHs between 2008 and 2019, and the light blue shows the average TLH operation time. Surgeon A has the highest number of TLHs, with 731 performed over the 11-year period. They also have the shortest operating time at little over 80 minutes. This operation time is significantly less than almost all of the other surgeons. Here, there are two graphs to demonstrate Surgeon A's data in more detail. The graph on the left shows how their operation time has decreased over time, and the graph on the right shows their conversion rates. This surgeon has also had consistently low conversion rates of less than 0.2% and operation times of less than 80 minutes after performing 151 TLHs in the most recent 5 years of the study. In conclusion, this study found that Royal Derby Hospital had performed over 1,500 total laparoscopic hysterectomies, making up the majority of all hysterectomies and making it the top hospital for TLH numbers in the UK in 2019. Conversion rates have decreased significantly and are lower than the national and regional average when compared to data published by Madhvani et al. In 2018. Departmental operation times average at 93 minutes, and surgeon experience has a significant impact on operation times and conversion rates. There's a need to further investigate how these findings impact on patient outcomes, and this is currently underway and will be published in due course. Thank you for listening to my presentation.